From the House of Commons is Conservative MP Gillian Keegan, a member of the Public Accounts Committee. And here with me in the studio is Bryony Albury, a spoken word artist and homeless support worker. Gillian Keegan, a very strong report that your committee has issued. But the government, of course, replies by saying, look, we're going to spend £1 billion by 2020. Isn't that enough?
Well, I think, first of all, you've got to look at what the report says in its entirety. So I think it's important to separate rough sleeping from also the temporary homeless situation, because they both have, whilst they both need homes for an answer, there are also more complex issues sometimes related to rough sleeping. So the 1.1 billion is what they're spending today on kind of, temporary measures. But I think really the investment that's going to be made, that needs to be made, is investment in lots more housing, and in particular social housing, because a lot of this problem has come in areas where there's very, very high rental costs, and people who are on lower incomes obviously are going to struggle to meet those rental costs.
I mean, it has to be said that the government's not terribly keen to talk about this. I mean, we have tried really genuinely for nearly a week to try and get somebody from the government to spell out exactly what they are doing. What do you want them to do in practical terms immediately? I
think immediately what we need to do is have much more coordination between local councils, DCLG, DWP, and to have a clear plan for how we're going to target getting more of the right kind of housing, and in particular, as I say, that's social housing. So far it's been quite light touch. That's been kind of one of the criticisms in the report. The responsibilities and obligations are there within the council. There's been some funding, there's been different pots of funding moving around, but ultimately you need to have a real focus on, first of all, helping rough sleepers with shelters, at least for winter, but also to help rough sleepers on a pathway into a home. But those in temporary accommodation, they effectively have been evicted in many cases, or they've been given notice to leave because they can't afford the rents. And what you've ended up with is the government or the local councils are actually spending more on temporary accommodation than they would if they'd have prevented that person becoming homeless in the first place. So we need to have a more joined up strategy, I think, to much more focus on preventing people becoming homeless, as opposed to picking up what are greater costs when somebody's in that situation.
Doesn't the government need to go back to first principles? After all, in the end, after the Second World War, which is the last great housing crisis, it was local authorities in the end who understood each local need and built council houses and the rest to provide for the emergency that flowed from the war. Isn't it now down to local councils to be refunded and able to do the same?
Well, they have indicated in the budget that some local councils, they will remove that restriction, so they could do that. Or it could be local councils working in conjunction with a local housing association. In my own constituency in Chichester, we spent last Friday actually with the CEO of the council, the head of housing, and the biggest housing association in the area, going around all the council housing and looking for opportunities where we can develop more council housing, and very good quality council housing, because also the building standards of council houses moved on a lot. So if you look at some of the newer properties, they are really fantastic. So we just need to get a lot more of those built.
Could you just wait with us for a moment while I go local and talk now to Bryony Albury, because you're working essentially in High Wycombe, which is not a place one would think had many particular large numbers of homeless, but you say there are a fair number of homeless. What are you experiencing at the sharp end?
So we're seeing a lot of people that are rough sleeping. I'm afraid I don't know the exact number off the top of my head, but
nobody does.
For instance, we run a winter night shelter from January through to the end of March, and we will be full. That's 12 bed spaces, and we'll have a waiting list for most of that time. And that's people who are just trying to get into the hostel spaces that are available, or desperately trying to pull together a rent in advance to make that first step into the private rented sector, which is sort of providing a lot of that low quality accommodation that you mentioned for quite a high rate. So it's a lot of money for our guys to get together when they actually don't have a bed of their own.
But then when you're working with, let's say, the dozen that are in there tonight, if you were to distill the problems between them, there would be mental health, inevitably.
Yeah.
There would be people probably who have either had some rental crisis or a landlord who's simply kicked them out in order to try and get someone to pay more, or whatever it is. I mean, what are you finding is the dominant feature amongst the people you see?
I think there's a lot of benefit issues. For example, delays in housing benefit being processed, or universal credit as people move on to that, as that's coming in. That's a huge one that I'm seeing. I do a lot of eviction prevention work, helping people access, avoid eviction. And a lot of those issues are simply because benefits are not being processed quick enough or effectively or correctly. So there's a lot of work to be done helping people represent themselves in court or access the legal aid system. So I completely agree prevention is essential, but without a strong benefit system that responds to people's needs as they change, as mental health issues crop up or physical health issues or bereavement, some change in family circumstances. If you have to wait over a month or 6 weeks, which is usual, you're going to have a problem with your landlord.
Well, these 12 beds that you're able to provide, and you've said are nothing like enough. I mean, how many do you think you'd really need if you were going to deal with the scale of the crisis you're confronting?
That's really hard. I think we quite often see the rough sleeper number bounce around 20 or over.
Are there other shelters as well beyond yours?
Okay, so there are local hostels that you can apply for, but the referral process takes weeks quite often, and they'll do it as quick as they can, but they're underfunded. So, yeah.
Well, let me go back to you, Ms. Keegan. One of the things which keeps cropping up is universal benefits system, that in fact the change in the benefit system, whilst perhaps good on some levels, is a problem in terms of bridging the moment that you need it to the moment when it comes.
Well, and possibly that's what's going on in High Wycombe. I know in my own constituency in Chichester, very few people actually are in receipt of universal credit. We haven't rolled it out, apart from to a very small group. So that's certainly not the biggest driver of homelessness, which has increased. Rough sleeping has increased as well.
But there's a sort of acceptance, isn't there, in government that the old system wasn't working well, that the new system needed to come in because it simplified it. But there is this problem in both systems that they are hard to navigate at the front end.
Well, I think that's why in the budget there were some changes to universal credit. There was a 2-week housing benefit that was introduced. There was also a reduction in the amount of time, I think from 6 weeks to 5 weeks. And there is also obviously loans available immediately, same-day loans available if anybody does find themselves in difficulty. And I think the prevention strategy is very much more of a focus, and there was more money also promised for prevention. Overall, everybody says, even the Joseph Rowntree Foundation, lots of people that I've met are in favour of universal credit. It's more the implementation, and clearly, on top of what we've got today, we do need to be very mindful of implementing universal credit with housing in mind, and with keeping people, not making sure that we create these problems of homelessness just from moving from one system to the other. But universal credit there has been some changes very recently, and it hasn't been rolled out certainly in many parts of the country on a vast scale. It's quite a slow rollout.
Gillian Keegan, thank you very much for joining us, and Brandy Albury, thank you very much indeed.